Very warm welcome to today's show and tell. Today you'll hear more about the work that we've been doing in developing a data platform for frontline workers with the partners that you can see at the bottom of this slides. For those of you who don't know me, I'm Genta Hajri. I'm Digital Innovation Delivery Lead at LOTI. And today you'll hear from my other colleagues from Hounslow and Social Finance, but I will let them introduce themselves when it's their turn to speak. I can see lots of people joining in, so we are absolutely delighted to have all of you in this virtual room. So to speak, we don't have the time to do introductions, I'm afraid, so please, if we could, first of all, if you could make sure that everyone is muted until it's your turn to speak. But if you could introduce yourselves in the chat, that would be really, really helpful for us to see who we've got in the room. If we could maybe move on to the next slide. I just wanted to share kind of the purpose of today. So again, you'll hear more about the project. We'll give you an update on the different activities we've been doing, and then we will invite your feedback and questions at the very end. If you do have a burning question that occurs over the course of the presentation, please can I ask you to put that in the chat, and we'll do our best to either answer it there and then, or we will kind of take the questions at the very end. So without further ado, let's launch into a quick reminder and introduction to where this project fits in, why we're doing it, and things like that. So you know, the names I can see in the room today I recognize, so some of you may be familiar with this, but this is one of two projects that LOTI funded as part of the new service models in adult social care innovation fund, which we launched earlier this year. So we offered up to 100k to two projects that kind of were keen to design and testing initiatives that look at the potential of new service models for improving outcomes for people with care needs to help them live thriving lives. And I think again, lots of you will be familiar with that, so I think I will hand over to my colleague Mark from Hounslow, who will tell you a little bit more about the project and why Hounslow wanted to focus on this very specific topic. Over to you, Mark.
Thank you, Genta. Yeah, my name's Mark Edmonds. I'm a delivery manager at London Borough of Hounslow, and this project was sort of developed to create a prototype for multi-agency data, to create a multi-agency data platform to equip frontline workers with better information about the residents in their care. I mean, from the sort of discovery piece that we did during the application, what became really clear from the practitioners who are working with residents, adult social care residents, was that they didn't feel that they had enough information or a lot of information about the agencies that they were involved with, and that usually on, say, in terms of a discharge team, trying to find out what agencies are involved to create a wraparound sort of care plan usually took quite some time. And so there was a clear use case for trying to develop this type of protocol which surfaces information about the service involvements that a resident has had in recent sort of in their recent sort of care history. The output of the project aims to develop and test a prototype to build on a similar tool that Social Finance have built in Stockport and Leeds called Family Context, which has been used in children's services. So the concept had already been established, the methodology is pretty much established, and we thought that this was a really good way of answering the problems that we saw, or the issues that we saw with frontline workers, but also doing it in a creative and a new way, which creates a new service model that we can roll out and use. We've worked with and started partnerships with Chelsea and Westminster, and with originally Hammersmith and Fulham, and now Brent. And we're taking forward this piece of work to understand how we can sort of share information between agencies in a much more rapid way and a useful way that sort of then reduces risk as well, because one of the key things that came out of the sort of user interviews that we've established is that actually where people have got no service contact is probably more interesting and more risky than those that have many. So again, we're looking forward to developing this and building the repository to house the information and store the information that is collected, and design and build the sort of matching hierarchy and processes that were needed for this type of project. So I'll hand over to Harry to give you much more detail.
Hi everyone, really nice to see you today. I'm Harry Angus and I'm from an organisation called Social Finance. Those of you who don't know who Social Finance are, we're a not-for-profit consultancy based out of London, but we're dotted all over the place. So I'm calling in from Bristol today, and we essentially deliver a series of projects which bring about some sort of social value or social impact. And so I'm from the Data and Digi team, and I can see a few colleagues have come onto the call today as well, so lovely to see you all. And we basically help develop digital products to essentially deliver social impact. And so, as Mark said, when we were doing the kind of bidding process and working out what sort of problems we wanted to solve with this project, we defined the kind of problem in three broad ways. And so fundamentally, with different agencies involved in care, provision can be disjointed. Agencies work in silos and they have little visibilities of how residents interact with other agencies, which can lead to poorer outcomes. And then finally, residents are not able to benefit from a person-centered model because the staff are unable to easily access the information required to deliver this. And so this isn't so much about unearthing every bit of information which is held in every system about an individual. It's more about giving practitioners who are starting to work with an individual a start of and understanding what that professional network around that individual looks like, so they can better coordinate support and care for that individual by getting in contact with the people who are already around them, in an effort to stop this duplication of work and a lot of inefficiencies around calling around and having to get stuck in switchboards, etc. We knew this was a problem within children's social care, and over many years we've developed a tool called Family Context, which is basically a digital tool to support workers working in children's services to do the same thing that we've proposed here. And so we've got this live in Stockport, and it's in development in Leeds as well. And I can kind of hear a collective intake of breath as I try and do a live demo here, so fingers crossed this all goes okay. But here's our demo site where you basically put in your username and details, you start your session, and then you're able to find the service involvement of an individual. So here I will search for Charlie Banks, who is our test person. You click the search button and then you get the results of Charlie Banks in the area. You then have the specific ID, so you can then work out who this individual is. You click into them, and then you can then see a breakdown of the different areas that we have records for that individual, and whether there are records in there, and where applicable, then contact details for the involved services as well. And so, as I said, this is live within Stockport at the moment, very much about children's focus. But when this project came around, it was a real opportunity to test this approach to see whether the approach was replicable, A, within the adult social care context, and B, within a very different geography. And so within the London boroughs as well, presents its own set of challenges. Populations are much more transient between boroughs. You've got lots of interesting things going on. And so this was kind of a testing of two approaches. A, can we take a pre-existing tool and deploy this within the adults context? And B, can we deploy it in a context which is much different to the ones which it was already deployed in? So in terms of delivery partners and the people on this project, we've got the people that Mark referenced in very early on. So our kind of lead partners, so London Borough of Hounslow, Chelsea and Westminster Hospital, and Brent, London Borough of Brent. We've also got Hammersmith and Fulham as our critical friend on the project. So basically giving some counter views, some kind of analysis of the approach. Social Finance is the delivery lead on the project and offering kind of strategic support and support in the implementation of the tool. And then LOTI is acting as the funder. And even though often with these projects, the funder can be quite remote, and not very engaged often. But what's really good about this project is that LOTI are right involved in the delivery, because they're really keen to learn how this approach can be scaled. Scalability is kind of coming at the key of all of our thoughts and design around the product, and it's really great to have Genta so involved in the delivery. So we meet on a regular basis to talk about progress and work through any challenges together, which is brilliant. So where has this been done before? There are lots of things in deployment at the moment called shared care records. And here's an example of 4, which we found from looking across the country. And a product like ours, we've proved has been kind of deployed within the children's context. But the key difference between these new emerging shared care records and what we're suggesting is that they're very much in the clinical operational side of understanding about an individual. So it's all around kind of allergies, discharge summaries, medication that the patient is on, etc., which is a level of detail which is inappropriate often for practitioners to access within other settings around triage, etc. And so where our proposed solution fills the gap is that by targeting it at triage and having absolute minimum data requirements within this, it's very much focused on the minimum privacy impact on the individual, but enough information to make that practitioner who's maybe triaging or trying to understand the depths of a case, give them the information that they need to then go out and speak to other practitioners to then work out what the full story is that's going on, to reduce the duplication of effort and to reduce the inefficiencies that we're finding from practitioners talking on phones, getting stuck on switchboards, calling around multiple GPs to try and work out where someone's registered without actually knowing, fully what's going on. Timeline and phase is how we're working. So we've been going since April 2023. We're pretty much halfway through the project now, and the project has been split into 5 distinct phases. And so we started up in April and in May, kind of with an inception and setup phases. We're now bang in the middle of targeted discovery phase. And so that's basically us speaking to frontline practitioners about their needs, wants and desires, their challenges as well, to basically understand what sorts of data they'd want surfaced within a tool. Soon, at the end of July, early August, we'll be moving into a design and prototyping phase, where we'll essentially be then building the tool itself. And so building the prototype within Hounslow, matching together the different data sets that we've identified through discovery, and starting to test that with frontline practitioners. And then finally, we'll be doing a synthesis of recommendations phase from October through to November, which is basically us surfacing a roadmap for the product. And so what does this need to look like as we move forward from prototype into kind of business as usual processes, and also really understanding what scale looks like for this product. And so we don't just want to build a tool for Hounslow with this project. We want to get a whole load of learning and a whole load of understanding about how such a tool could be scaled across different London boroughs. And in terms of ceremonies, we're meeting and working in a very agile way. And so we've got fortnightly sprint planning sessions, tongue twister there, weekly stand-ups between the core project group, and then there's a monthly project board for governance, the next of which is taking place tomorrow. And so we've got a good layer of governance on this, and we're being really kind of communicative and respond to challenges as and when they arrive by communicating so clearly and effectively. This is just quite a nice slide, I think, in terms of how we're approaching the product delivery and the product design. And so rather than LOTI saying we want this lovely shiny car and Hounslow saying we want this lovely shiny car, and us going element by element, so the wheels and then the chassis and then the body of the car and then the car, at this point no one's really that happy at any point right into the end. And that obviously comes with a whole load of risk, especially with such a complex project in such a short time scale. Lots of people have attempted stuff like this before in this space, but it's a risky, difficult space because there are lots of challenges around information governance, aligning people with a shared view on the governance. There's lots of technical challenges that can arise as well. So rather than going through this approach of saying absolutely we're going to only surface the prototype right at the end of the project, we're very much doing an iterative approach. So developing the skateboard first, which obviously no one's that happy with a skateboard if they've got a car, but then adding on this different elements as we go, constantly going back to users to iterate and develop to understand how we can evolve through these different stages rather than getting stuck and delivering a project which doesn't fit for anyone. It's about getting that minimal data sets required so we can get to that very much a minimal viable product approach, so we can get things into the hands of practitioners which should hopefully be able to start to evidence the outcomes for families and individuals as we move through. So who have we spoken to so far through discovery? We've spoken to 4 individuals within Hounslow's first contact team. So that's the front door to adult social care services, including service managers, deputy team managers and social work assistants, and then 2 from Chelsea and Westminster Hospital. We're lining up more interviews now with further people from the hospital and individuals from Brent as well. And so that's very much on the front line practitioners to understand what sorts of information they need and how they need it, how they need it visualized, what sorts of systems and services they struggle getting information with, and the workarounds they currently have in place to try and get to that information. But we're also very much intending to speak to information governance colleagues, strategic leaders, data managers as well, to understand that full picture around scalability, long-term kind of success for the project, and their views as well, which is really key. So it's a good blend of both those frontline practitioners and those more strategic roles as well. And what are we asking them within the interviews? We're understanding their information gathering processes when working with cases. We're understanding what makes these processes more easy / more difficult. We're understanding what their understanding is of the consent model of information governance. And so in terms of getting consent from an individual before they look up their records, and their understanding of the legal basis, because obviously this is a really key thing we want to get right. And without a really robust ethical and governance framework around this, the project falls apart. And then finally, we look to develop a prioritized list of information that they most acutely want to see within a family context style tool when they're working with these sorts of cases. And these are the sorts of things that they're telling us. And so each of these different colors is indicative of a different individual. So you can see really clearly the sort of maps, word map of what people are asking around different services that they're asking for. And we've defined kind of 4 emergent findings that we've had from the interview so far on the side here. And so a bit of a surprise for us is that there's a definite need for the tool, but it doesn't seem to be a tool that's desired. Whereas in the children's context, it was often used as a first port of call, because the adult social care model is very different, where thresholds for support are very high and fairly clear. What we're finding is that this is a kind of supplementary tool that won't be useful in every case, but will save a lot of time in a small number of cases. And so rather than being a small time saver in lots of cases, it's a big time saver in fewer cases, which is a slightly different model to the children's one, which was interesting. Practitioners across the piece, so within the hospital, in the different places that we've spoken to individuals in the hospital and within social care, we found that practitioners are concerned they're duplicating the work that has been done elsewhere already in the system. So we're hoping that our tool will do some good work in rectifying that. We're getting a really good idea of what sorts of services people experience most pain in drawing information from, which are the services that they spend hours on the phone to, which are the services that are an absolute kind of trying to get water out of stone from. So that's been really interesting. And practitioners spend an inordinate amount of time doing what they term as detective work to try and gather information. So it's really, they spend a lot of time digging. And what's interesting here is that we're surfacing a lot of information that practitioners can get and do get. However, it takes them a long time and a lot of hassle to get that information. So we feel the governance case for this is really robust in that. So who are we talking to next? We've got frontline practitioners from Brent that we're lining up within their equivalent of the first contact team. Further Hounslow staff who are in the hospital social work team, so that discharge team that Mark referenced earlier on, and the strategic leaders and managers. And so we're all on track to finish our interviews by the end of July. And then we're going to borrow some time from a future sprint to basically write up our findings. But these findings are already informing the technical work stream, which we're already starting to put into motion. So developing that repository within Hounslow itself, getting that in place so we can start matching to these data sources that we're starting to identify back here. And so it's a really interesting project, lots of different players involved, lots of different little hurdles that we didn't quite expect at the start of the project, which we're coming up against and finding out about. But it's been a really interesting learning kind of pathway so far, and really looking forward to seeing how this product continues to develop as we move through into the prototyping phase to get a bit of a better understanding of what this product might look like and how it might function on the ground. Coming up next then. I think, Genta, was this you coming back there, or is this me?
Please carry on.
Yeah, cool. And so we're going to finish our user research and write up the findings, and that will be published in a discovery report. We'll continue the work that we need to do in order to access the health data to support this tool. And so health data in particular is very difficult to get hold of on a personalised level. So we're working within various boards across the Northwest London region at the moment to try and get access to that data. We're commencing the build of a repository within Hounslow itself, completing the IG work to commence the prototype build, and then begin to match the internal and external data sets. And so we're at about the halfway phase of the project. It's a very busy time, but a very exciting time. And we're really looking forward to seeing how this progresses. And we'll be more than happy to come back to do another show and tell later on in the project to kind of feedback some of the learnings that we've had from the actual technical section of the project. These are the key contacts. So Genta, of course, Mark and myself. Really happy to spend a good chunk of time now answering any questions or responding to any feedback that anyone might have.
Thank you, Mark and Harry. So open to the room really for any questions you may have about any of the aspects of the project or anything you heard today. We had a hand. Sarah, did you want to come in or?
Hi, yeah, I think I lowered it at the same time, but I did mean to put it up. It was really. I'm from Kingston Council down in southwest London. It was really interesting, and my I suppose what my observation is where. So I work in adult social care as a digital commissioner, and I've only been in here since January, and I've learned lots how social workers work and working with health partners as well, which is a whole new field. And it was just really interesting, Harry, where you've talked about obviously there's one London, but the detail in there is just not appropriate of what social work practitioners need. But I wondered, with the tool, are there plans to sort of try and present some of this information back to colleagues in health to make sure, because I know, their main ambition through the ICBs is they always talk about bringing health and social care data together, but I would predict they probably don't know all of that social care data that social work practitioners need out in the real world, if I can put it like that. That's what my observation is from being there. So it's fascinating though. So thanks so much.
Yeah, it's a really interesting space, and we're very much intending for the longer term project that this be surfaced then to those health practitioners in a way as well. I guess the risk is that you don't want to over systematize the sector, so you don't want people having a whole bunch of different things that all do a slightly different thing. And what we heard from one person during the interview so far is that there's lots of systems out there all trying to do fairly similar things, but they all do it kind of badly. And so you have to, again, replicate that detective work kind of across then different systems. And so we're very in tune with that as a challenge. And what we're doing at the moment, we've gone to there's a new systems committee which exists within the Northwest London area. I don't know whether it exists in other London areas as well, but that's basically there to try and do that. So we're engaging with them about the potential product and what that might look like in the long term. And yeah, I think if we even got to the end of this project and the prototype is very immature, I think that's fine, because the amount of learning that we're unearthing around how different the interface between health and social care and the ICBs, I think that's interesting in itself. And we're doing a lot to try and kind of grease the wheels of greater information sharing between the two. So yeah, it's stunningly interesting.
Harry, we've got a couple of questions in the chat. I think the first one is for you. So Jane Hanser is asking, is the plan to have both Brent and Hounslow data coming into the platform as well as health partners in the first instance, and how frequently will the data come in? So
this is all stuff that we're trying to define through the discovery phase. And so I think we've spoken to Brent and Hammersmith and Fulham about this as well. And I think that the appetite to share with quite an immature product isn't the highest, which makes a lot of sense. You kind of want to know exactly what the thing is you're sending information to, is the information robust, etc. So we've taken the security requirements from the WSIC IG board, which is the Northwest London IG board, and they basically have a set of security requirements that they have to have in order to be able to have confidence to share data in. And so we're very much building the tool to that standard. And whilst early on, I think that our intention was very much that we'd have everyone sharing data in, we recognise that with the timescales of the project, we might not be able to build the confidence in the tool itself before that point. And so it's very much part of our consideration for scalability. And the scalability question comes along like, will the long-term destination for this product be within Hounslow? Will it be hosted by someone like LOTI or some other sort of pan-London place? And so that's all the sorts of things that we're trying to unearth through the discovery and try and get to grips with as we go through the project. So it's very much about learning. And so we are speaking closely with Hammersmith and Fulham and Brent colleagues about the scope of this, but then you also get to interesting things where Brent have got an MDM of sorts as well. So it's about understanding what the landscape out there looks like, and then understanding as well for differing councils of differing data maturity, how ready are they to accept this sorts of tool and what work needs to be done to get something like this in place. And so it's all part of what we're learning as we go through, and the design will very much be shaped by those conversations as they go through.
Thank you for that, Harry. So we've got another question from Owen, which I'm happy to take. So Owen is asking whether we've engaged with the public on the project and its ambitions. So Owen, I'm assuming you mean the general public when you say the public. So again, LOTI works in the open. So we've obviously shared all the details of this project on our website. But obviously I am conscious that's not kind of purposeful engagement in the sense which I think you mean. But again, please jump in to correct me if I'm wrong. Again, as Harry and Mark mentioned, this project is about creating that prototype, and we're doing a lot of discovery work. So we're kind of engaging mainly with the frontline practitioners and kind of other layers of seniority, if you like, to develop the tool in the best way possible and in a way that meets kind of it meets the needs of the frontline practitioners who the tool is intended for. So in that sense, we haven't yet engaged with the public for that kind of for those reasons, but I appreciate kind of where your question is coming from, because obviously this involves the public's data.
Sorry, I was just about to kind of inject in terms of some of the other data projects that we've seen of recently getting derailed by that kind of lack of consideration about the use of public data, so things like GDPR and care data and all that kind of stuff.
Absolutely, and that's been, we haven't shared this today, but the reason that kind of we would have been a lot more advanced, I think, in the delivery of this project had it not been for the amount of time that we've dedicated to that data sharing bit of the project. We absolutely take that seriously. We've got Mark has got his hand up, which I think means he wants to come in to add on to this, but without putting a spotlight on my colleague Victoria, she's the Pan-London Information Governance Leads, and she's been doing a lot of work. Hi Victoria, a lot of work on this front. So I just want to assure everyone we are taking the data sharing aspect very, very seriously, and a significant chunk of the time from, I think, March time, which is when we announced the project, up to now has been spent on that. And that's why the interviews couldn't happen until, I think, June time. But yeah, Mark, first of all, over to you, and then maybe Victoria to you to add anything I may have missed on that point.
I was just going to add that we've, as Harry mentioned, we've gone to the North West London IG board, and we've also gone to the new systems committee, both of which is to sort of highlight what the product does and the sort of explaining how the data will be used. One of the outcomes of that is that we've been advised by the IG board to go to the actual data controllers for each of the data sets which we require, which is the acute data, the GP data, and the community hospital data, and to speak to them directly to see whether or not that would require changes in privacy notices to the use of that data or in engagement with residents. So we're in that space at the moment. So we haven't got a clear outcome on that yet.
So the project, and I supported the project to do a data protection impact assessment for the work. I think it's valuable to note that broadly, the data is data that each party would have access to. It's at the moment they have to ring round lots of different places to figure out which organisation might be involved, whereas the project is aiming to bring that information together too. So it's not as if data's being sort of shared for brand new purposes. It's for the same purposes that adult social care are undertaking now. This is to ease the process along. Within the data protection impact assessment, there is a requirement for the pilot to be reviewed in IG terms before a decision of further rollout is taken. So there will be that review at that point. Obviously, Mark's talked about all of the extra IG considerations work that's taking place right now. And the project, interestingly, is able to look at 2 different local authorities who have a slightly different opinion or risk tolerance around this work. So it's actually going to be value to the project to have a local authority that maybe has a different risk tolerance that isn't as comfortable at the begin with, and that's why Hammersmith and Fulham are acting as the critical friend. So even within the relatively small pilot, their social care team are approaching these considerations slightly differently to Hounslow and Brent social care teams, and we're factoring all of that into the data protection and the information governance, the assessments and the review. So I'm confident as an IG professional that this project is managing those things accurately and correctly, and that review process is built in all the way through.
Thank you very much both. So I'm going to try my best to take the questions in order. I believe Martin raised his hand. So Martin, you're next, and then we'll take the questions in the chat.
I feel like Pauline's question was there first, but I don't know. I'll ask the question. So I was just wondering. It's great work, by the way. I think it's really really noble to try and bring this stuff together. I was just wondering, presumably this data is in different systems run by different people in different organizations, and I wonder how you get in that balance between the desirability, like prototyping things and bringing that data together, compared to the technical feasibility. So often bringing data from different systems together, especially as you'd probably like to have this in kind of real time wherever possible, it's promised that it's possible, and then you get down to it and it really isn't. I was just wondering how you're striking that balance really between what's desirable, viable and feasible.
Yeah, it's a really interesting point, and there's an extra interesting thing to it around kind of, even with engaging to try and get the kind of willingness to do it, if you engage at one level of a local authority, you might not have the engagement from a different level of a local authority, and so you need all of those things in place to square it. And that's why I think we're spending such a good chunk of time as well on the technical feasibility, and basically sitting with Hounslow to develop their MDM solution, so master data management solution, to basically understand the core data sets and how they can be matched together. And so we've got really clear data schemas for the family context product, which basically says it strips it down to the absolute bare bones of what you need from a data set in order to be able to match it together and then get the value that you want. And so I think it's as simple as like ID from the host system, date of birth, address, forename, surname, and then that's the matching criteria. And then where possible, I think for this one, because whereas in the family context system, NHS numbers weren't as important, whereas in the adult social care system, those are so much more important and should be held by the organisation. So that's an easy common identifier to then match against different data sets. And then you then got the supplementary information, which is about the service involvement and whether it's current or not. But you are totally right. Some places have access to their back-end data systems. Some places don't. Some places might have to pay a lot of money to order to get access. Some people might be able to extract it on a weekly basis. And so that's very much why this is like a discovery prototyping piece, to understand the feasibility of this sort of thing within the adult space. Because there are lots of things which are doing this at the moment, and anything that we can do to kind of grease the wheels in this space is helpful for the emerging kind of ICB style of working. And I think Mark, it's fair to say this is probably the first major ICB partnership-y style project of the North West London ICB. Would that be fair to say?
I think so. Yeah, definitely.
And so it's very much a kind of like, it's a bit of a shame we're not doing this project in 3 years from now, because I think it would be much easier. But I kind of see this as our first good attempt at trying something in this area, seeing how we get on, feeling about the learning really clearly, and then if we get on brilliantly, then that's brilliant, we'll get a really good tool. If we find it challenging, then there's really good learning and really good action points for how the ICB can work more effectively together in the future and going into the future as this new kind of style of working gets deployed. Go on, Mark.
Yeah, I was just going to add, I think one of the key benefits for local authorities for this tool, and as Hounslow see it, is the development and build of a data repository that will hold the information that we are looking to access, and how that then can inform our business intelligence strategy, how we work forward in terms of understanding and planning for population health management, and doing sort of more strategic work around service planning into the future. I mean, some of the data sets that the NHS have, they're predicting future demand on services were 20 years in advance based on the sort of modelling processes that they employ. So I think for local authorities, we need to get into that space a lot more as we're working with the NHS more closely. And this is a really good first step in terms of understanding those requirements and how to build that for the future. So I think there's a lot of positives.
Thank you, everyone. And just to kind of add as well that, Martin, you're right, there's a fine line between the balance of is this tool desirable and is it technically feasible. And I think LOTI, decided to support this and back this with, with cash because we wanted to test the potential of kind of data to inform new ways of working, new processes within boroughs. So that will kind of help advance our thinking and knowledge in that front. Let's move on to Pauline's question, who's asking, how can finance support the work of this platform and use the data for monitoring budgets, activity-based costing for demand-led services, and improve decision making due to financial pressures? Really, really good question, given the kind of financial pressures in this sector. Who wants to jump in?
Mark, do you want to take that one?
It looks like
you're on mute, Mark.
I'll take some of it. I think what's really clear from the work that we've done to date, there's some clear efficiencies that can be gained from employing a tool of this nature. We've done a few interviews with practitioners, which have sort of suggested that some of, in terms of when leaving hospital, there could have been a three-day process in terms of understanding all the elements that need to be put together for a sort of a package of care and support in the community. And so anything that we can do to reduce that sort of delay at discharge is, one, good for the patient, but in terms of costs that would be generated both by the discharge service and the acute costs of a hospital setting or extended stay, all of those are I suppose points which can be measured and costed, and to see what the benefits actually are and how they can be realised. So I think it's a great project for that. I'm not sure I can give you any sense of the scale of it, but there's certainly, people are certainly discussing there are key savings to be made and some efficiencies. Does that answer some of it? I'm sorry if it doesn't answer all of it.
Harry, did you want to add anything?
Yeah, I was just reflecting while Mark was talking, and the governance on this stuff is very difficult, and so often you have to, whilst it feels intuitively like this could be really supportive for financial modelling and forecasting. I think you have to be very careful when you're dealing with this sort of data about the legal gateways, and it's already kind of, we touched on the sensitivity as well a little bit, and being really explicit about what it is you're using the data for and why. And so I think at this stage, it's very much about that kind of care and impact and understanding the kind of provision around an individual. But I think it's definitely something we could factor into the long-term scalability of the future of this model. But I think it's fair to say we're in a very narrow and specific use case at the moment, because that's where we thought we'd be able to show the most progress and hit some of our key outcomes in the time frame that we have for the project. So yeah, really happy to kind of bake it into our thinking around the long-term scalability. But I think for the purposes of a prototype, we'll be looking less at that financial side, if that makes sense.
Great, thank you very much for that and for the comments which I can see in the chat. I think the next question is from Jane Hanser, probably one for you, Harry. So Jane is asking, what is the feedback from your interviews with regards to the value of this approach versus that of the shared care records? So yeah, are you able to elaborate on that?
Yeah, sure. And so I think the One London isn't currently live within Hounslow and isn't currently being accessed by the frontline practitioners who we've spoken to so far. So when asking them and speaking about the kind of tools and systems that they use, it's quite narrow at the moment in terms of they generally have access to their own case management system, and then otherwise it's much more limited. And I don't know what the long-term strategic kind of view is of One London, because I think that's the shared care record that we're speaking about in question here. I know with where I used to work in Bristol, connecting care was very much in the hands, which is shared care record there, was very much in the hands of these sorts of practitioners. But the feedback from there, and what I'm kind of preempting the feedback would be from the practitioners once they have access, is that there's a lot of unnecessary noise in there as well. And it kind of alludes back to what Sarah said as well. These practitioners are working on a very tight timescale. They're very rapidly trying to find out a nugget of information to find out what the network around an individual looks like, who's already offering the support, is there a safety net in place, and if not, does that safety net need to be put in place? And the shared care records are great for operational delivery of health stuff. So rapidly understanding medications, allergies, etc., understanding very rapidly what a discharge summary looks like. And I think it's fair to say the usefulness that we're finding out within the hospital setting is more limited of the tool that we've been speaking about. When we've been speaking to the kind of frontline health staff, they've said, oh, well, I'd just go and speak to the person, or I just go and I'd instead access this system I already have access to. But within the social care context of that discharge and entry into social care place, it feels like the real value is there. And those are practitioners, I think, that might be excluded from the shared care record space because of the nature of their roles and the fact that it's kind of in that halfway house between direct care and working out direct care as a thing, and it exists in quite a funny position. And so that's kind of where we're squaring it with the shared care records, because I agree on the face of it, it feels like this is quite duplicative, but when you actually get into speaking to the practitioners, these are and also when you think about the individual as well, the impact of accessing a shared care record is absolutely everything about you, whereas the privacy impact of what we're proposing is very much just you can kind of infer that certain stuff might be going on. So for instance, if they're accessing a dementia service, you can infer that there might be some form of dementia diagnosis. But the key thing is you then have the practitioners who will last in contact with you and last in touch with you, so you can contact them and then understand that. That does bring challenges of its own, obviously, because we don't want to add more volume and burden into the system on these workers that might already be stretched. And so there's something that we're working out there. But this is the whole point in spending such a long time in discovery and speaking to all these different practitioners. It's about understanding and unearthing these challenges and working out, is this thing viable in the area that we've chosen to have a look at here, and why that might be different to the children's social care space.
Thank you for that, Harry. Just conscious of the time, and you know, we are kind of drawing close to the end, so last call for questions. Again, please raise your hand or, you know, put your questions in the chat. Great, looks like we don't have any other questions, but if these do arise after the call, please do get in touch with either myself, Mark or Harry. You've got the contact details on the slides. We will share the slides with you, and we will share the recording of this as well, of this session, on the LOTI website. So just final thank yous. Thank you to our presenters, thank you to my colleague Victoria, and most importantly, thank you very much to you all for making the time to be here with us today. It's likely we'll have another one of these show and tells later in the autumn, once we've reached the next milestone of our project. But thank you very much and have a good rest of the day.